If you work with us at the Medicare Family, we're going to ask you what state you live in, what county you live in, what your zip code is. And you think, what does that matter? Isn't Medicare a federal program? Isn't it the same in all 50 states? Yes. Medicare, government Medicare, is the same. It is a federal program. It's the same in all 50 states. However, your insurance, what we help you with, your private insurance is very, very different depending on your state. And even within your state, from the north to central to the south of your state, could be very different prices and benefits. So for example, with a Medicare supplement plan, what state you live in matters. Because if you live in New York, a Medicare supplement plan for a woman turning 65 this year is going to be around $300. If you're a woman in Ohio turning 65 this year, it could be around $100. Big difference, right? Florida at about $50. It's not as expensive as New York, not as cheap as the whole Midwest. So within the state of New York, you're going to see a big price difference. Now, that's not a good example because New York City being so big, but let's say within the state of Ohio, you have all those different cities. You have 5 basically equally sized cities in Ohio, and the price can vary if you're in a city versus in a rural area versus what city you are in. And you're like, well, how does that make sense? Why is that? It's a for-profit business. These insurance companies are trying to make money. They know the data. They have all the data of how much people spend on Medicare, how they spend it. They get all that from the government. And they say, ooh, Cincinnati looks like a very profitable place. We're going to put a low price plan there because we want to get the business there because that's a healthy, I'm just making this up. I'm not saying specifically Cincinnati's a healthy place, but Cincinnati's a healthy place. And so we're going to have low rates in Cincinnati. We want that. Those people have access to great hospitals, competitively priced hospitals. We want that business. Then they look at Northern Ohio. And I'm just saying this. I'm just as a scenario. They look at Northern Ohio and they say, ooh, Cleveland. Cleveland Clinic, very expensive hospital. We don't necessarily want that business because a lot of sick people might move there to be closer to that more expensive hospital. And just Cleveland in general might not be as healthy, might be a sicker city with higher costs. So they're going to have a plan that's not as competitive there because they don't really want business from Cleveland. They would love to have the healthy business from Cincinnati. So that's something that we are walking you through. Now, it varies from year to year because one insurance company might say, hey, we're coming in to Ohio new this year, so we're going to have low rates. We want to get a lot of business everywhere. And then another company that might have been in business for the last 3, 4, 5 years says, we're going to sit this year out and they won't have as competitive rates. And that's why if you come to me this year, I might recommend Aetna. And if you come to me next year, I might recommend Cigna. And this is if you're in the same zip code. And if you come to me the following year, I might recommend Humana or United Healthcare. So this, for a Plan G in the same zip code with a female turning 65, I could recommend a different company every year or every couple of years. That's because this is a moving target for these insurance companies. So you're like, my sister turned 65 3 years ago, and she bought Mutual of Omaha, and she loves it. I want Mutual of Omaha. I'll say, okay, I'm going to pull up the computer and show you all your options, and I'll show you what Mutual of Omaha is, and you'll say, oh, that's not bad. And I'll say, yeah, but maybe look at AARP. It's $30 a month cheaper for the same Plan G, the same benefits. And that's where people go, how is that? You don't really want to know how all the sausage is made. You just need to know it's based on profits, where they think they can be the most profitable. And when they think that they can't be profitable, they raise their rates, or they have to raise their rates because they have too many sick people on a plan. Now, if you live in different states, your laws can be very different as it pertains to Medicare supplement insurance. For example, if you live in California, Oregon, Washington, Idaho, Louisiana, Nevada, there's more. I think there's only like 16. Those states have vastly different rules. So in most states, if you want to change your Medicare supplement plan after you first enroll, a year or 2 or 3 later, you can do it at any time of year as long as you can answer the health questions, meaning you're healthy enough. But in 16 of those states, you can do it during certain times of the year, and they all have different. Some before your birthday, some's after your birthday, some's on your policy anniversary, some are any time of year. In those states, you can always move if you're sick. You are guaranteed you'll always be able to move your plan. Now, as you can imagine, Medicare supplement plans cost a lot more in those 16 states. In the other states, since they don't have to take people that are definitely going to cost more, they can keep their rates lower. So that's why it's a lot more expensive in New York, where you can do it anytime, than Ohio, where you can't. So that's something to take into consideration when you're getting ready to retire and you're thinking about moving. Where to retire to? That is a very important consideration that most people don't even know exists. They think it's just the same. So we want to tell you what it looks like if you retire to Florida. Would you be able to change your plan, or would you get locked into a plan because they don't allow you to change if you're not healthy and you're not in your initial enrollment period, which is true for Florida. Or you might want to move to California where you can on your birthday. So if you're thinking about getting ready for Medicare, retiring, or you're thinking about moving and you're on Medicare, book a free consultation with our team at themedicarefamily.com on our website. There's a yellow box to book your free appointment. We work in all 50 states. We'll talk to you about your particular unique state laws and what to expect price-wise. Thanks for watching. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.